Here.
I think both are important.
Yeah.
Yeah, both, exactly. I think you have to...
It prolapses
That's good.
again.
I think it's a nice position. A little deep, but it's okay.
So I'm rotating
so in this position, you should push
counterclockwise.
the device out.
Can you make echo
Okay.
bigger, please?
Carlos, do you think that perhaps...
I think it's the angle here.
Carlos, you think that probably while you are taking the device out of the delivery catheter, by giving a more posterior turn onto the delivery catheter, would anchor better on the landing zone?
Actually, Anton, yes, okay, he's released it. The best is to do X-plane on this view. Do an X-plane, keep the same 45, and you can see two views simultaneously. Yes.
Oh, it's prolapsing.
Very good.
No, I think we're not that bad right now.
No, it's better now.
It's better. I think we are just over the circ, and then I'm going to try to deploy the disc. Very careful.
It's tending to prolapse now.
Can you see the angel, at least in picture, please?
This is a bit proximal.
I agree, Sabo. You know what? The superior portion of the
Not covered,
disc is not covering the mouth.
You have to angle the sheath.
Yeah.
The way you can get it is counterclockwise the sheath.
Exactly. I was doing that.
You can resheath it and counterclockwise,
Yeah.
and then you angle it.
You would go more anterior, Saivam, or posterior?
I think retract the disc, get the ball back, and counterclockwise the sheath, and it'll direct it slightly anterosuperiorly.
Sabel, the company recently released some new guidelines how
Yes.
to... But I was discussing this with Horst Sievert, and it's very difficult to place the device according to these new guidelines.
Right.
So most of the people went back to the traditional way.
Right. The new guidelines mentioned that actually.
Carlos, Pedro,
Yes.
We are right on time to move to the lab 4. I think we can do and go over there for a long OCT follow-up of polymer 3DES.
Can you see the pictures right now? Just a sec. I think
not bad, actually.
I got a better position here.
That looks...
Yes, this is better.
So let me take a
This is
picture
good,
before we
actually.
leave.
Yes, that's pretty good. Can you
Esse
see?
contraste.
Can you go to Angel?
Yeah, we're going to take a
angiografia,
picture
por
on
favor.
Angel. In fact, Rodolfo is taking care of that.
Yes, okay. Okay.
You see, there was a bit of uncovered atrial appendage in the superior portion. What do you think, Saibo?
Yeah, you see, I know it's a small uncovered portion, that's all right. You could have got away with it if you tilted the device a little bit, but this is acceptable. Because there's no flow. There's no flow around the device.
Yes.
I think it's...
Looks great. I think we should deploy over there.
Do you think we should release? What do you think?
To check stability.
Uh-huh.
Once more.
Don't you try some pull and...
Bit more tension on the
Okay.
We just look at the shape of the lobe. It should look like a tire
Exactly.
and not like a cylinder or a strawberry.
Yeah.
Then you know it's compressed.
You know what? I'm going to try to...
I think it's fine. I mean, you can do one more angle.
Well, I'm going to try one more time. I think we have to leave.
Yeah, that's a little
But
bit...
I would accept that. But, you know, let's look for perfection
I
here.
think it's fine. I think it's fine.
I'm going to try one more time, Antonio. I know you guys have to leave. I don't have any problems with that. I think it was a nice demonstration of how to implant. It's kind of tricky. I'm going to try to rotate counterclockwise, posterior, and see. Maybe this position is good as it gets. Maybe I won't be able to put the device in a better position, but I'm going to try. That's the advantage of this device. It's recapturable and redeployable. So I'm going to try to do that, okay? But I have to leave you guys.
Last month we had a device that embolized. It was quite a struggle to get it out.
If it embolizes?
It embolized, and the patient had a prosthetic valve in the left ventricle, so we had to take it out from the venous side.
Okay. You did transeptal and
yeah, we took it out transeptally. It was,
what did you use? Use a snare or?
We used a snare, and then we had to use a big sheet to get it out from the vein. We had to use a sapien sheet.
I see. You did a very large sheet.
Thank you.
Okay, congratulations.
Bye-bye.